Welcome back. We are just 1 week and 1 day away now from Medicare's open enrollment deadline. Joining me now are two senior advisors at FHK Insurance, Nikki Johnson and Chris Fuel. It's nice to see both of you.
Good morning, Molly. Thanks for having us.
Absolutely. Good morning to both of you. Your company has been helping people find the right health insurance, which is a big deal, for more than 50 years now. That's really pretty incredible.
Yeah. Lots of action happening right about now. The Medicare annual enrollment period will end in just 9 days. Believe it or not, time has flown by very quickly, but there's still time. So if you haven't had a chance to evaluate your plan options for 2022, you can do that.
That truly is right around the corner, just like you just said. What is one of the biggest things I'm wondering that you're seeing during this open enrollment?
Yeah, a lot of people have been evaluating Medicare Advantage plans, and all of those companies are going to offer really great benefits and awesome coverage, but you really have to take a look at every plan in particular. I recently met with a client and reviewed her medications and her plan design overall. And once we went through everything, she ended up spending over $1,000 on a medication that was not covered by her formulary. Now for next year, she's going to have that prescription covered at a very minimal copayment. So between the premium savings and the plan savings, she's saving thousands, which is awesome.
Wow, that's a lot. You've got to feel good about that. And especially as we scroll through all those benefits, it just makes me realize how much people have to consider as they look at comparing plans. Chris, I wonder, how about you?
Yeah, so another thing that people can do right now is compare their supplement to a Medicare Advantage plan. I actually recently met with a man who is in his late 70s, and between his premiums for his supplement and his standalone drug plan, he was spending about $6,000 a year just on premium. So after reviewing his situation, and and his medications and his doctors, we found an Advantage plan that was going to be a good fit for him. And not only did this plan offer him things that he didn't currently have, like dental, vision, it also covered his drugs much cheaper than his current standalone prescription drug plan. And not to mention, it was going to be a guaranteed savings of at least $1,500 a year, but more in the realm of like $3,000. So, and don't get me wrong, we represent a lot of supplements and standalone drug plans. And depending on each person's situation and what their specific circumstances are, those are absolutely the plans they should be on. But as the Advantage plans get more competitive, those supplement premiums go up. Nikki and I are seeing more and more people come from Medicare supplements and switch over to Medicare Advantage plans.
Interesting. I want to talk about ACA plans because last Friday we were talking with one of your advisors, JJ Kravitz, and he brought up the Affordable Care Act plans. So those are sometimes for people who are not on Medicare, or maybe they have employers' health insurance plans too. So what can you tell people about these ACA plans? What do they need to know?
Sure. So there's, similar to Medicare, there's like three main takeaways as well. There's a lot of plans to choose from. It can be confusing, not to mention time consuming, comparing all those options. And there's a deadline coming up, just like Medicare. It's right around the corner.
Yeah, so when is that deadline? Because people need to be aware of when the period ends.
Yep. So if you want coverage for January 1st, the deadline is December 15th.
Okay, so like we said, that is coming up. I can't believe it. I looked at the calendar. December 1st is this week. It's like, wow, we got a lot of things going on right now. So I guess in closing, what are some of the takeaways?
Yeah, the big thing is knowing the difference between an insurance agency and an insurance company. So FHK is a local family-owned health insurance agency. We have been helping people with their Medicare plans and health insurance for over 50 years. So there's a lot of expertise in this building. We know our stuff. But when you call an insurance company directly, you're not going to get all 32 Medicare Advantage plans like we have here in southeastern Wisconsin. So when you call into FHK, we are local. We're here to help. We're ready to help you with plan evaluations and make sure that you're making the most of those Medicare benefits. When you call a company, you can't get that. But when you work with an agency like FHK, we have access to everything. So,
yeah, I mean,
good way to provide peace of mind.
Can you imagine calling all of those insurance companies?
Oh,
Yeah.
no, it would take forever.
Yeah.
Yeah, not just time consuming, but it's like super confusing and complicated for you to try to figure out, okay, how does this plan compare to this plan and which one's better for me? Plus, whether you call the insurance company directly and you enroll with them, or you call FHK and enroll through us, you're going to pay the same price. Plus, we're here for you throughout the year. So should your situation change, maybe there's a change in your health status, you move, something like that, we're here all year. And it's the same thing for ACA.
Yeah, see, I think that's huge for people to have that type of guidance. And in closing, Nikki, what do you think is the key to FHK's growth?
Yeah, we're here. We're personal. We're ready to help everybody. And we are able to provide that peace of mind for clients. And they know that when they enroll in a plan with FHK, they're not only getting the most robust coverage, but like Chris said, we're here all year round. So we can help with customer service issues, anything you need. And our services are completely free. So no cost to you.
You guys are both so friendly and perky too on a Monday. I love it. It was wonderful to see both of you.
Great to see you again.
Happy post-Thanksgiving and happy holidays to both of you and your families.
You as well.
Thank you so much.
Thank you. And to reach any of the senior advisors like Nikki or Chris, give them a call at 414-228-7555. Or for more information, you can visit their website. That's FHKinsurance.com.